Just a heads up, the booking portal for boosters for kids aged 5 to 11, it is now open after a major update from the province's top doctor yesterday, including changes to COVID isolation guidelines. We're also expecting an announcement from Health Canada reportedly approving an Omicron-targeted vaccine. There is a lot to discuss and break down. So joining me now, infectious diseases specialist Dr. Zain Chagla. Welcome back to the show, Dr. Chagla.
Hi, good morning.
Okay, so let's begin first. I want to start with the bivalent vaccine. This is one that is Omicron specific. We're expecting to get that approval today. Doesn't mean it's going to be in arms tomorrow, but a lot of people had the question on the difference that this is going to make when it comes to the pandemic. But also, should you wait for that, or should you be getting what's available now?
Yeah, I mean, this is really good news. We have a limited amount of data around what this shot can do kind of in real life. So in this vaccine, there's about half of it that's targeted to the B1 variant, the first Omicron variant we saw, and then half of it that is essentially the original mRNA from before. And so, the hope here is that you trigger better Omicron responses. We know people, for example, who had BA1, the first Omicron variant, the data from Portugal that just came out yesterday suggests they still have very good protection against BA4, BA5. And in the data that Moderna had released, when they gave this vaccine to people who had either had COVID or hadn't had COVID as a four-shot, they saw antibody levels that were two times higher than people who got the original vaccine. So potentially this means that there may be more protection against severe disease for high-risk individuals, that there may be more protection against kind of that waning of infection. Right now with the fourth dose at 6 to 8 weeks, it might be 12 or longer weeks with this type of thing. Really, really a lot of hope here in that sense, and a lot of proof of principle that we can adapt these vaccines as the virus changes. Mm-hmm. If you're still high risk right now, today, someone who's over 60, someone who's immunocompromised, they should probably be getting the dose that's available to them right now, because we don't know exactly when this is coming into arms, how it's going to be distributed, et cetera. If you're someone who's low risk, who hasn't gotten their fourth dose yet, or even their third dose yet, and is waiting for it, I don't think there's an unreasonable risk with waiting a couple of weeks until we understand when this is going to come out and who's applicable to it, considering it may be a bit better in efficacy going into the winter season.
Does it concern you, Dr. Chagla, that uptake on boosters in general across the board in various age groups seems to be down? What role does that play then in this pandemic?
Yeah, look, I think the vaccines have done an incredible job in terms of changing what we see in this pandemic, right? Our ICUs that are at low capacity right now, despite how much COVID there is in our community. So people are not getting as sick. I think we really have to make sure that we're focusing first and foremost on the highest risk community. So those living in long-term care in congregate settings, in shelters, those who are over the age of 60, those with immunocompromising states. We really have to make sure vaccine uptake is optimal in those groups, that they get every dose available to them, because they're going to be overrepresented in healthcare. The rest of the population, I think there is still a reason to be taking a shot going into the season, considering it might just lessen the amount of transmission going out there. It's not going to change the dynamic, but it will probably bring it down a little bit and give us a bit of a cool-off period. But I think, again, the focus now and knowing what we know about these vaccines should be making sure that the highest risk people are immunized and they understand how to access these vaccines, and no barriers should be put in place for them.
A lot of information coming out of that news conference from Dr. Kieran Moore. So we do know that the portal is now open for the kids who want to get boosters 5 to 11. That is available now. But also one of the pieces that a lot of people have questions with is that 5-day isolation period. So at the end of the day, Dr. Moore is saying, listen, if you are symptomatic, you should be staying home regardless, but that 5-day isolation period, like that's set in stone, that doesn't need to necessarily be in play if your symptoms are gone and whatnot. There's more details to it. You can find that on our site. But your reaction, Dr. Chagla, to lifting that 5-day period?
Look, a lot of people are uncomfortable with this. I actually think it is pretty pragmatic. Look, COVID is here to stay. We're going to deal with COVID this year, next year, the year after that, the year after that. And at some point, we have to stop saying that, we have to isolate this virus particularly for 5 to 10 days and all the other viruses out there for, until people feel better. Yes, people may be transmissible going to their community. They still need to wear a mask for the 10 days. They need to make sure they don't see people that are vulnerable, go into hospitals or healthcare settings unless they have to. And they need to disclose that they have COVID to people in those settings if they have to access them for emergency reasons. But at the same time, I think we have to think pragmatically that, we're going to have 5 to 10 different respiratory viruses circulating in the winter. It's going to be confusing for people to say, if they have a runny nose, a sore throat, they get a negative test. Is this COVID that had a negative test? Is this another virus? Should I be isolating for 5 days or 10 days? I think this really just tries to lump it to say, look, feel better first, then wait for 24 hours, then go out in public, wear a mask, and follow the precautions in that sense. I think it's much more sustainable this way and reflects, other provinces as well as other countries in Europe that have adopted this approach moving forward.
Okay, Dr. Zain Chagla, a lot of great information there. As always, thank you for joining us.